Every week, someone sits across from me and says the same thing. Doctor, we've tried everything. I've heard this sentence thousands of times, and every time my answer is the same. You haven't tried everything. You've tried everything we've offered you so far. That's a difference. My name is Dr. Gennady Musher. I've been practicing medicine for more than 3 decades, and I run the TMS Neuro Institute in Los Angeles. In the next 9 minutes, I'm going to tell you exactly what TMS is, what it isn't, how it actually works, who it's for, and what you should honestly expect from it. No marketing, no miracle promises, just what I've learned from treating real patients year after year with this technology. When patients tell me they've tried everything, 2, 3, sometimes 7 different medications, I tell them the same thing every time. You haven't tried everything. You've tried everything we've offered you so far. There is a difference, and it's the difference this whole conversation is about. Let me show you what TMS actually looks like, because the version in your head is probably not what happens in my clinic. You walk into a quiet room with normal lighting. You sit in a comfortable, oversized recliner. You're fully awake. You can listen to a podcast, look out the window, or just plan your day. A technician places a small device, about the size of a thick paperback book, against the left side of your forehead. You hear a steady clicking sound, like a glass metronome. You feel a light tapping on your scalp. Some patients describe it like a gentle woodpecker. Others say it feels like someone tapping a spoon against the side of their head. That's it. The session lasts about 20 minutes. No needles, no anesthesia, no sedation. When it's over, you stand up, walk out, and drive yourself home. The next day you come back and do it again, 5 days a week, for about 4 to 6 weeks. That's what TMS looks like from the outside. Now let me tell you what's happening on the inside, because once you understand that, everything else makes sense. And we have to start somewhere uncomfortable. With the model of depression, you've probably been told your whole life, the one that's incomplete. For decades, depression was treated as a chemical imbalance. The thinking went like this: too little serotonin, antidepressants would adjust the chemical environment in the bloodstream, and the brain would respond. For many people, that approach works. It has helped millions. But for about a third of patients with major depression, it doesn't. No matter how many medications they try, no matter how careful the dosing, the chemistry shifts. The depression doesn't. For a long time, we didn't understand why. We do now. What brain imaging has shown us over the last 15 years is something the old chemical model couldn't see. Depression isn't just about chemistry. It's about communication between specific brain circuits. Think of your brain less like a chemical soup and more like an electrical network. Behind your forehead, slightly to the left, there's an area we call the prefrontal cortex. It's responsible for mood regulation, decision-making, motivation, focus. In a healthy brain, this region stays active. It modulates emotional signals from deeper structures and keeps the whole system in balance. In a depressed brain, this circuit goes quiet. The regulator stops regulating. Meanwhile, deeper emotional centers can become overactive, flooding the system with negative signal that the prefrontal cortex can no longer hold in check. This is what people are describing when they say depression feels like fog, like watching their life through a thick pane of glass, like sleepwalking through their own day. It's not a personality flaw. It's not weakness. It's not something to think your way out of. It's a circuit that has gone quiet and a system that's now running unchecked. Here's the analogy I find myself using most often with patients. I want you to picture something with me, a lock that nobody can open. Imagine a lock that nobody can open. Every locksmith in town has tried every key in their collection. The same kind of key, slightly different shapes, but the same fundamental design. None of them work. That doesn't mean the lock can't be opened. It means we need a completely different kind of key. Medications work on chemistry. They flood the system through the bloodstream and hope the dormant circuit wakes up on its own. For many patients, it does. For others, the chemistry shifts, but the circuit stays quiet. TMS is a different kind of key. It doesn't work on chemistry. It works directly on the circuit. Let me put this clearly, side by side, because the differences matter. Medication adjusts chemistry through the bloodstream. It's systemic. It affects the whole body. The side effects you've probably encountered: weight gain, cognitive fog, emotional flattening, sexual dysfunction. Those happen because the medication is acting everywhere, not just where you need it. ECT, electroconvulsive therapy, what most people picture when they hear shock therapy, requires anesthesia. It induces a controlled seizure. It can affect memory. Effective for some patients, but invasive. TMS does something different. It uses magnetic pulses, the same kind of magnetic field used in an MRI machine, delivered through the scalp, targeted at a single specific area of the brain. No medication entering your system, no seizure, no anesthesia. You're awake the entire time. The only common side effect is a mild scalp tingling during the session. Different mechanism, different delivery, different consequences. The FDA cleared TMS for major depression in 2008. Since then, the indications keep expanding. OCD, certain forms of migraine, smoking cessation. Research is actively underway for PTSD, anxiety, Parkinson's, and several other conditions. The mechanism is the same in all of them. Let me show you. A focused magnetic pulse passes safely through the skull. It induces a small, highly targeted electrical current in the underlying brain tissue, repeated thousands of times across a course of treatment. This targeted physics encourages the dormant circuit to start firing again. Over weeks, the brain's own neuroplasticity takes over. New connections form. Old pathways strengthen. The prefrontal cortex begins to do its job again. This is not theory. This is what brain imaging shows happening in real time, in real patients. Let me be specific about who actually benefits. There are 4 common paths to the treatment chair in my practice. The first is treatment-resistant depression. You've tried at least 2 antidepressants at adequate doses, for adequate time, without meaningful relief. That's roughly 30% of all depression cases. The second is medication intolerance. You can't sustain the cost of antidepressants, the weight gain, the sexual side effects, the cognitive fog, the emotional dullness. You need an alternative. The third is philosophical. You'd rather address the underlying circuit problem than manage symptoms with medication indefinitely. That's a legitimate position, and TMS is built for it. The fourth is what I call add-on therapy. You're currently on medication that partially helps, and you want to push beyond the plateau. TMS is not an either-or. For many of my patients, it's the thing that finally makes everything else start working. There's something I need to warn you about, because not enough clinicians do. When you start TMS, the first week often feels like nothing. You show up, you do the sessions, you feel exactly the same. That's normal. The brain doesn't change overnight. But then, around week 2 or week 3, something happens that frightens people. It's called the TMS dip. Look at this curve. 6 weeks, 5 days a week, about 20 minutes per session. Week 1 is calibration. Almost nothing changes. Week 2, things start moving. Often the first noticeable shift isn't mood, it's sleep. Patients who haven't slept well in years find themselves sleeping through the night. And then comes the dip. Around week 2 or 3, some patients suddenly feel worse, more irritable, more emotional. They panic. They think the treatment is failing. They want to quit. But here's what's actually happening underneath. Circuits dormant for years are starting to fire again. The brain is recalibrating. The dip is the signal that something is finally working. Week 3 is usually where the real shift happens. The fog lifts. Cognitive clarity returns. Motivation returns. Weeks 4 through 6 are consolidation. The new pattern locks in. I want to be honest with you about something. I will not promise that TMS will work for you. I'm a scientist. Intellectual honesty is more valuable to me than false comfort. About 30% of patients don't respond meaningfully to TMS. We don't yet have a way to predict with certainty who will be in that group and who won't. What I can tell you is this: if standard treatments haven't worked for you, if you've cycled through medications, tried therapy, done the work, and still find yourself drowning, that's not a verdict on your resilience. It's data. It tells us your particular brain requires a different kind of intervention. By the end of treatment, somewhere between half and 2/3 of patients with treatment-resistant depression achieve meaningful symptom reduction. About 1/3 achieve full remission. They're not just better, they're well. These are the numbers from large clinical studies. About 30% of patients don't respond. That's the reality. But for the majority who do respond, TMS works on a layer of the problem that medication can't reach. Here is what I most want you to take away from this video. The capacity for recovery does not have an expiration date. It doesn't matter how long you've struggled. It doesn't matter how many things have failed before. The brain you have today is still capable of forming new connections, strengthening dormant circuits, feeling things it hasn't felt in years. That's not optimism. That's neurobiology. If you've been told there's nothing left to try, I want you to hear this clearly. You haven't tried everything. You've tried everything that's been offered to you so far. There's a difference. And there's a conversation worth having about what comes next. Everything I just walked you through, I've prepared as a presentation you can download and keep. The link is in the description below. If this video helped you understand something you've been struggling to make sense of, share it with someone you think might need it. And if you want more conversations like this one, practical, honest, science-based, subscribe to this channel. I'll be here every week. I'll see you next time.